I feel like you guys clearly understand the main sort of active ingredients when we're talking about retinols and vitamin C's, but a lot of you have asked about the more sort of advanced or lesser known active ingredients, things like peptides, ceramides, hyaluronic acid, etc. So let's talk a little bit more about that. So depending on your skin type and your tolerance to actives, you'll have your basic skincare routine, and this can include your cleansers, toners, and then serums, and then your moisturizers and SPF. Generally in the morning, in the evening will be cleanser, toner, active serums, and then things like your retinols and things. And also very much depends on your frequency of use. I know a lot of you have mentioned that you're using glycolic too often or too little, but again, it all depends on how tolerant your own skin's barrier is, and you can add in other serums like ceramides, for example, to help replenish and strengthen the skin's barrier. So let's start with that. So ceramides can come in serum form, or they can come in a moisturizer kind of form where it's a bit thicker consistency, and they just help with a lipid layer of skin, protecting the skin's barrier and helping to increase its sort of strength. Now, peptides are short-chain amino acids. These are the building blocks of proteins that are needed in the skin, like our keratin, elastin, collagen. So again, they're really going to add to that anti-aging effect. So if you're at a stage in your skincare routine where you think you're ready to add in more sort of active add-ons, peptides might be one that you add in. Really popular ones are things like copper peptide serums. Now, things like hyaluronic acid are obviously more commonly used to retain moisture in the skin surface, and again, normally come in the form of a serum. And then lactic acid, again, normally will come as a toner, and it's just a more gentler toner to help exfoliate the skin surface. So there are lots of active add-ons. My recommendation would be not to use too much at once and start slowly into building to a routine, but certainly after you've been using an established routine like I have for a number of years, you can add in things like peptides and ceramides. And if you're confused, obviously just get some advice from your skin doctor, dermatologist, or aesthetic doctor, and they can help you navigate your skin journey.